Pediatrics, it's a field of hope and a field of the future. You know, every touch on every child is you're impacting not just that child, but what their life does, and also that family. Pediatrics in general as a whole is doing so well with a lot of these complex kids that Kootenai Health recognized that there was a need for pediatrics to evolve as well. And that's everything from when you roll in the door and you're born and postpartum to if you have a need of little extra level of care. And that's where we take that handoff from these community pediatricians and family medicine doctors, and we welcome their opportunity to share their patient with us and let us care for them in an arena that we are skilled and comfortable doing. At Kootenai Health, we specifically focus on family-centered rounds, and that's something we do from our neonatal intensive care unit to our pediatric floor. With adults, you know, you'll kind of see them slowly start to decline, and even with any kind of kid, this is where it gets a little tricky, is they have such enormously awesome bodies that they're fine until they're not fine. You know, with an adult, I can get a very clear history and understand what they're feeling. With kids, you have to be a little bit of a detective and be able to look for very subtle signs and really rely on the family to be able to help explain, you know, what's normal, what's not normal, what's different, because families have an incredible ability to recognize what's off. That is something that we really stress, and that's something that we want the families to know, is that we are here for you. That's why we're here, working towards making sure not just you have a plan, but that's communicated effectively, not just to the family, but also to the child who's really quite scared, and to make, again, a difficult situation a little bit better. And in turn, send you back home to your pediatrician where they can again make sure that you're growing up and doing wonderfully well. You're not just treating today, you're actually treating tomorrow. And where this child goes and who they impact can come from these tiny little moments that we might call just a regular day at work, but for that family, that will be ingrained in kind of where their lives go. And that's a pretty incredible opportunity.